treat, educate, and communicate what the significance is of this wonderful technology.
Hi, I'm Dr. Anthony DeCesaro.
And I'm Dr. Dustin Barton, and together we've served thousands of individuals with this technology.
By going through this video tutorial, we're going to give you the certainty that you need to be confident to treat the patients that are in your community. We look forward to seeing you inside.
Mapping is used in conjunction with our other means of evaluation and examination to figure out where to apply StemWave. It's one of two methodologies as it's subjective. When we map an area, we're looking for actual feedback from the patient by them telling us where they feel discomfort, or we can also look at the patient if they're wincing a little bit or if they're pulling back or they get a grimace, almost like an apprehension sign, because some people, even though they feel it, may not necessarily want to admit it. So we have to be very well aware of how the patient is responding to the care. When mapping, we will use between 50 and 150 shockwaves at 2 to 3 hertz with a slightly higher energy level than we'll be treating at. We use StemWave for two reasons, primary reasons. One is to reduce pain and inflammation, and the other is to create new blood supply in the area, angiogenesis or neovascularization. By creating new blood supply to an area that we're treating, we can then recruit stem cells which create a regenerative effect and healing. Although mapping is a great means to tweak out pain and inflammation in the patient and allow us to find great areas to treat, it doesn't replace the need for a proper history and examination. And along with that many times is diagnostic imaging and special tests. When mapping a patient and receiving that verbal feedback from them, what is that telling us? The patient is telling us it hurts, but what does that mean? In most cases, it's going to mean that there's inflammation in the area, and the inflammation is the cause of the pain. So when we're mapping at a slightly higher energy, we're tweaking and pulling that information out from the patient. It helps us identify what's going on in the area. And then when we treat the area, we'll be able to reduce that pain and inflammation, as well as creating a regenerative environment after several treatments and or after several weeks of care. People sometimes think that when we map, it's an individual type of process. What's great about mapping is as we determine the area that needs to be treated, and again, we're using the history, the exam, the testing, but the mapping to really localize and to tweak out the area of pain and inflammation, we can go right into the treatment. We can turn to the machine or to our StemWave. We can change the frequency or the amount of shockwaves per second, and we can also change the intensity as we go. So if we're using a little extra intensity, a little extra energy, or energy flux density is what it's called a lot of times in the research, to get that response from that patient, and we're going to treat there, we can turn to the machine, lower it, and then continue treating through, which is perfectly fine. So we don't need to separate mapping from the treatment, which could take additional time. We can go straight from the mapping right into the treatment, and a lot of providers like to do it that way. When mapping and treating with StemWave, how we hold the actual applicating device, the applicator, is very important. We generally want to take a pretty strong grip with a fist, so it's very comfortable. And if we want to put energy straight down, then obviously we have to have it angled in that direction. If we turn the head left or right, because it's a focus unit, that's where the energy is going to go. There is a time and there is a place to use angles. And we've covered those in other videos, whether we're in the spinal gutter and we want to aim more directly into the spine, or if we're moving up the bicipital tendon and we want to get into the labral region and other areas in the body as well. But please be mindful that when we're using the StemWave head and we're moving it around, that it's focused almost like an hourglass, and if we want to change the angulation on it, it will change where the shock waves are going.
You're going to be spending 48 seconds in any of the areas that you mapped out that you found that were from day one, and you'll come back. It might be 3 times, it could be 5 times. 2 of them might get really, really good real fast with that same intensity, and you might spend the rest of the time on one area. Now, when I talk about one area, let's say it's the knee, let's say it's the medial side of the knee, this is such a focal point. When you get on the area, start acting, go clockwise and counterclockwise, like you're trying to trace the outer edge of a quarter. Because where the rays are vectoring is a different area of, think about hitting the mountain. You're hitting a different ridge of that inflammatory process in there. So instead of just holding it directly, make sure you're being fine-tuning by acting like you're trying to trace something in there versus just laser pointing it the whole time. Because you can keep it on a quarter and just be moving the vector and stay on that area for a half a minute if you really want to, because you're going to be hitting different sectors of that inflammatory pocket if they can handle it. But just to sit there and go like this for 30 seconds, yeah, that's going to hurt. That's going to hurt. Maybe you do that later on if they ask you to, or you want to, or you feel that the doctor says that's what we need to do for whatever reason. I don't recommend it. But once you find an area, think about the vector. If you're a chiropractor listening to this, not everything's P to A. Not everything's left to right. There are torques and there's forces and there's vectors. You got to think outside of the box of just left, right, forward, and backwards.
Mapping is essentially looking for and identifying if there's inflammation present. If there's not inflammation present, typically you're not going to have a biofeedback. If there is inflammation present, you're typically going to have a biofeedback. So the purpose behind this is it's more of a show and tell. So at the beginning, most of us who have not utilized this device are unaware of where the body actually holds inflammation. After a while, you'll find that there are specific patterns in specific areas that you'd be able to go to without finding a biofeedback. So mapping in general is when you're looking for an area that you're unsure of, would there be a biofeedback? And when you find that biofeedback, that would be indication of perhaps some inflammation, and you would work on that area as seen in our videos, so that you can best identify other areas as well too that perhaps would have inflammation. So in general, what you're looking for when you're mapping, the reason why you're mapping is day one, you don't know what you're working with. You don't know if they have inflammation. You don't know if you can help them. So mapping is let's see versus we know we can. And then in the future, on subsequent visits, you may still be in the mindset of mapping because things are going to be constantly changing, which is why we have individuals utilize a lower hertz in the first couple visits, because you don't want to be wasting waves in areas that do not contain perhaps inflammation.